I know this video is a lot later than I planned it to be. I mean, a lot later than I planned it to be. Had a lot of issues over the last couple of weeks, which stopped any kind of real study. But hey, yeah. This one actually kind of was a bit weird when I was doing this one, because a lot of this one was researching genetics, genes, and although that kind of research isn't in this video because obviously I can't put that research in here, I did go through it all, because you have to understand what all that means. What I do, I like to understand it all. I can't put it all in the video because YouTube doesn't like that kind of stuff, and it would flag my videos and take it all down. This one took a bit of yeah. Actually, I'd never heard of this one for many reasons. It's quite a rare disease, and doesn't come up very often. I heard about it randomly, actually, when I was watching something, and it piqued an interest. But I do think it's something people do need to be aware of, considering how rare this condition is. It's called Tey Sachs Disease. I'm pretty sure that out of the 19,000 videos I've got, some of you might have heard of it. It is extremely rare. It's a neurological disease. It is caused by the death of nerve cells in the brain and the spinal cord. It is inherited. No ifs, buts and maybes. There is a lot of research done on this, which is incredible really, considering how rare it is. Scientists and whatever, they know a lot about this condition. This condition is very well researched. It is very well known in the scientific medical communities and things like that. But as a disease in itself, it is one that was very rarely out there. It's not one that's out there very rare. You can't just catch it and you can't just get it, and it doesn't just happen by chance. It is inherited, completely inherited. It is most common in infants, and we're talking newborn. You're born with it. And if you get what's classed as infantile Tay-Sachs disease, your newborn will develop normally for the first 3 to 6 months before they start showing any symptoms. So they could start showing symptoms within 3 months, or anywhere between 3 to 6 months they can start showing symptoms. Once they start showing symptoms, they will start to deteriorate. This disease is fatal to infants. They have a lifespan of 3 to 5 years. And I think that's the saddest part about this one. This one kind of got to me a bit. Infantile Tay-Sachs disease is 100% fatal. The first 3 to 6 months they develop normally, they do everything a normal 3 to 6 months will do, and then everything starts, the symptoms will start to show themselves. Within 3 to 5 years, they're gone. And the disease progression is awful. They will literally become vegetables, but in pain. They'll become painful vegetables. It's like stabbing a vegetable over and over again. By the time they're dead, it's horrible. It's a horrible disease. There are 2 other variants to this condition. There is a junior to adolescent one. They can start showing symptoms anytime between the age of 5 to the late teens. If that happens, they will have a lifespan of sort of several years. it's not as severe as the infantile one. The disease progression is a little slower, it's a little bit more milder. It's still horrible, but they have a longer lifespan. If it comes in at 5, they can, between 5 and sort of late teen, they thrive and survive until, well, they don't thrive, but they survive to sort of teen years or late teen years. It is a lot more rare than, there are others. It's just that there's a junior and there's an early adult one, and the early adult one, if they start showing symptoms as early adults, actually this one isn't always fatal. Some of them actually end up living through this. It's not quite so severe, it's a lot more mild. Some of them will become fatal, but not all. If they start showing symptoms of Tay-Sachs in early adulthood, it's not always fatal. But that's even more rare than all the others. It's the rarest condition of all. It really is. It is completely genetic. The one thing I did learn, now, as horrible as this decision is, anyway, this condition is one of the worst I've seen, one of the worst ones I've ever looked into. It actually only affects certain types of people. Now, as horrible as it is, it's worse. This is completely genetic, but now there's nothing I can do about this, and there's no way I can stop science or medical whatevers, and there's nothing I can do about this particular bit. Genetics is genetics, and don't come for me. They have found that this genetic condition is found within the Ashkenazis, which is the Eastern and Central European people, and those with Jewish heritage. They've also found that with all the genetic testings they've done, they found that those that have the other variants, that the Ashkenazi and the Jewish heritage are more known for the infantile Tay-Sachs disease, which is the most common. They found that with now they do the genetic testings on these people, these communities, sorry, I didn't mean to offend, these communities, that they can help them stop the progressions of these diseases run through these families, and reduce the amount of occurrences. But the other variants actually are more in common with people like the French Canadian communities in Quebec, or the old Amish communities in Pennsylvania, and even in the Cajun populations of Louisiana. They've actually found the other variants of the condition, which I find kind of interesting. But yeah. Now, this was where a lot of the research kind of trailed off, and this is where I started getting a lot of headaches and a lot of migraines, and this is where my research kind of stopped for a while, and it took me a little bit longer to kind of whatever, because I had to start looking into the genetics. And although not a lot of that, hardly any of that is in this, because I couldn't put all that in there, a lot of talk about that because I couldn't pronounce half of any of it. I will give you what you need. The research is out there. What you need to know is that what it is it's the variant gene hexa that carries the Tey Sachs disease. Look it up. Seriously, look up the variant gene hexa. There is a lot about that. There's a lot of information about that and its variants and how it works and all of the things that happen around that gene. There's a hell of a lot of information about that. It's worth reading, it's worth looking into, and I encourage you all to do it. Now, the one thing that they do say is that there are recessive genes amongst the people that carry this condition, carry this hexa gene. You can be born with a recessive gene, even if you have parents with both parents with the hexa gene. You can actually still be born with a recessive gene. But if both parents have this hexa gene, you are more likely and at a higher risk of actually producing symptoms, having a more active hexa gene and actually starting to produce symptoms. If one parent has the hexa gene, you are much lower risk, and the chances of actually actively getting tax is much lower. But there's still a chance that you could still inherit the variant gene. You can actually get tested during your pregnancy. It's a simple blood test. For genetic testing, it's a simple blood test. If you are part of any of these communities, it is very important that if you're going to start a family or thinking of starting a family, or if you've become pregnant by accident, getting tested is important. It's extremely important, especially if any member of your family has ever had tax in the past, or has it now, or has ever seen symptoms of it ever. It's extremely important that you get tested. Or even if you're worried that it might be in your genes, getting tested is easy, simple. It's a blood test. They'll test it, they'll do a genetic test for the hexa gene, and they'll tell you. They can even do an actual test to see if it's a recessive gene or not. And if it's not a recessive gene, when your baby's born, they can actually do a test on your newborn. And if your baby is born with a gene, they can test to see if it's recessive or not. It's very easy, it's very simple, it's non-invasive, and it won't hurt. So if you're a part of these communities and you have any fear at all or any worry of this condition, a blood test is all it's going to take. Because these symptoms are horrible. I will go through them. There's a lot of them. So here we go. The infantile form of Tay Sachs. These are the kind of symptoms you will start seeing around 3 to 6 months old. They will start, things like exaggerated, sort of startled responses when they hear loud voices. The tumble dryer's on, don't worry about that. It makes weird noises, don't worry about it. You got cherry red spots in the eyes, a loss of motor skills, things like turning over, crawling or sitting up, muscle weakness, which will progress to paralysis. So you'll then see movement problems, seizures, vision loss, blindness, hearing loss and deafness. So, and they do specify both, because vision loss doesn't automatically mean you'll go blind. But actually in this case, it will be a gradual loss of vision and then they'll go blind. You'll get a gradual loss of hearing and then they go deaf. It's not that just because somebody gets hearing loss doesn't mean they're deaf. Just because someone has vision loss doesn't mean they're blind. But it does progress. It is a progression in this condition. You get one and it progresses to the other. You get things like problems swallowing. That will progress. They don't just have problems swallowing to the point where they can't swallow. They end up being tube fed. Loss of mental functions, which means that now we all understand that mental functions is everything. Everything you do requires a mental function. And then lack of responses to surroundings. know, and then a growth in head size. Now this is the only one that has that, a growth in head size. Now the juvenile form, now these symptoms vary in severity, and your survival rate is sort of from sort of childhood to teenage years. So the juvenile form of Tay-Sachs starts around the age of 5. You'll start seeing symptoms around the age of 5 to sort of late childhood. So sort of 5 to sort of 10. Yeah. And the survival rate is to sort of your teenage years. So, and we're talking teenage years. Now they don't specify when in your teenage years, so you could be any time between 13 and 19. You could start seeing symptoms at 5 and you could survive to 13. You could start seeing symptoms at 10 and survive to 13. Or you could start seeing symptoms at 7 and survive to 19. Or anywhere and everything in between. Yeah? Because there doesn't seem to be anything linking, there doesn't seem to be a time specification. Well, I couldn't find one anyway. For this particular one, it just says early, from childhood, sort of early childhood, late childhood to teens. And teenage years are 13 to 19. So you start seeing symptoms at 5, you could survive to 13, or you could survive to 19. You start seeing symptoms at 10, you could survive anywhere from 13 to 19. And so the survival rate and symptom rate could correlate anywhere. Either way, regardless of where you sit the symptoms, there's still a time limit, unfortunately. But you start with things like behaviour problems. This will start with things like, when we say it starts, but the symptoms vary in severity. So we have a list of symptoms, and it goes a bit kind of, I suppose it would depend on how, So we've got behavioural problems with this one. Gradual loss of skill, because of course you've now got a child who has the ability to talk, think, move, act, do things, the ability to read, write, do things that children can do. So you've got a gradual loss of skill and motor and movement control. Okay, so you start, on top of the behavioural problems, we've now got this loss of abilities. Frequent respiratory infections. A slow loss of vision and speech, a decline in mental function and responsiveness, and the seizures as well. Okay, the list isn't quite so vast as it is with the infantile one, but it's still just as serious. If you start seeing symptoms like that from your child, and they do carry the gene, you need to go and see a doctor instantly. No ifs, buts and maybes. If, however, you get through childhood, teenage years, and we get to late onset or the early adult, and you start seeing symptoms, this is the rarest form of this very rare condition. And it begins in late childhood right through to the early adulthood. And these, they do mix a kind of bit with the juvenile form. But the symptoms vary in severity and they don't always impact life expectancy. This is the one that could possibly not be fatal, from what I found. And we've got muscle weakness, clumsiness and loss of coordination. We've got tremors and muscle spasms, the loss of ability to walk, problems speaking and swallowing. This one, however, comes with things like psychiatric disorders and sometimes the loss of mental functions. Now, you see a doctor the second you start seeing symptoms, regardless. Doctors will start going through your medical history and your symptoms. If they know, if you've already got a history and a genetic history of this, then genetic testing is always important anyway. But if you've already got the genetic testing done, they might do a diagnostic testing to see whether the gene is recessive or not. If that's already been done, they could send you to all sorts of other things, because that is important. That is the most important thing to them, is to find out whether or not they have this gene in them and whether or not it's recessive or active. If, however, they diagnose you with Tay Sachs, if you actually get a diagnosis of Tey Sachs disease, regardless of what age and which one you get, you will be seen by they will sort of send you to a neurologist and an ophthalmologist to have your nervous system checked and get you an eye exam. Those are really important. There is no cure. Right now, there is no cure. And as this present time, there are no treatments that can currently slow the progression of this disease. None. All they can do right now is provide treatments to help you manage the symptoms and prevent complications. Their treatment programs right now are there to offer support and comfort. That is it. So they will offer antibiotics and anti-seizure medications as and when needed. You know, they offer respiratory care. They help with nutrition and hydration, because obviously you have difficulty swallowing, eating. So things like tube feeding, and if they need to do it surgically, they will. That is something they absolutely offer. If somebody needs if they need to be tube fed, and it needs to be done surgically, they will surgically give you a surgical feeding tube. That is something they absolutely do. Things like physical therapy, of course. Occupational therapy is something they offer. Speech and language therapy they offer. And that is your treatment. That is what they offer for anyone that is diagnosed with Tey Sachs. Can we call it Tey Sachs disease. Right now, they are researching different kinds of treatment and potential treatments for this condition. And they are actually hoping in the future, at the moment they're still doing a lot of research on this, but they are hoping in the future to do things like gene therapy, stem cell transplants, or even enzyme replacement therapy. They don't know right now whether or not it will cure it or help slow the progression of the disease, but they're hoping that they'll be able to use these treatments in the future. You know, but right now they're still in the research frame. They're still in research form. It is a shame that there really is nothing else out there right now, and there's still a lot of research being done on this condition. But hopefully, you know, hopefully soon there'll be a breakthrough in the research, and those suffering will have a glimmer of hope, especially those with the infantile, because not only is it awful for those with the condition, but for the poor parents that are watching their kids go through it. Couldn't imagine that. Wouldn't want to be that. No, it's definitely one of the worst ones that I've had to research, but definitely needs to be brought to light. Tey Sachs disease is definitely one of the cruelest diseases out there. that I've come across so far. And I think everyone should know about it, or at least a little bit about it. And I do encourage all of you to have a look at the research on the variant hexagenes, because it'll help you understand exactly what it means and how it works. I'm going to go, and I shall see you all later.